And we are talking about COVID.
Huh?
That's why you came prepared
what
here.
What we talking about? Well, I was on the plane. You know, I was on the plane. I was not taking those chances because of the story.
From the plane to here.
I don't want to mess with you. You know, anything happen. And I was on the plane. I got a wife and children to go back home to.
Makes sense. And it makes sense because COVID is on the rise here across the DMV. Really all across the country. The D.C. region experiencing its first big wave of COVID transmission in several months. This time, it looks a little different, though, both in how the public is responding, how we can measure and prevent it. So Dr. Amesh Adalja joining us now and breaking it all down. Good to see you, Dr. Adalja. First,
hey.
What do we need to know about this increase? I mean, are we talking, is this something that we need to be worried about, or is this going to be kind of one of those flu situations that we see every year? It's ever changing. Where does this go?
So the level of worry really depends upon what your risk factors are for severe disease. So if you're somebody that's older, had a lung transplant, pregnant, heart, lung, kidney disease, yes, you should be worried because this virus still remains a threat to you. If you're an average risk person, yes, this is sort of the norm that you're going to deal with year in and year out, and it's something that's kind of unavoidable. So it really depends upon risk factors for severe disease, which is very similar to other respiratory viruses that prey on those individuals who have other risk factors for severe disease.
Got you. There's a school in Montgomery County. It's made headlines lately for requiring kids to wear masks again to avoid getting COVID. In your opinion, will we have to go back to these measures?
I don't think this is going to be a widespread phenomenon.
Okay.
There may be certain outbreaks that occur in given organizations like a classroom in a school or a business where they might temporarily use targeted masks to be able to get cases under control, to decrease absenteeism. But I don't think you're going to see any kind of widespread requirements for this. But certainly organizations can use masks as one tool if they're experiencing an outbreak.
Okay, what about the latest booster vaccine? Of course, that was just approved, I think, earlier this week. What are your thoughts on that helping to prevent the spread of COVID-19? I mean, we saw in Florida, the Surgeon General down there is saying nobody should get it. Other people are saying do not listen to that messaging. What do you think about the latest booster vaccine?
I would tell people to disregard anything that comes out of the Florida Surgeon General's mouth. It's usually disinformation and overt lying. He's not a good trusted source there. He's a political panderer, and it's unfortunate that he has such a government title, but that's not anything that anybody should follow. The new vaccine is going to be beneficial primarily for high-risk individuals to keep them out of the hospital. So no matter what your age, if you have a high-risk condition for severe disease, this is something you should take advantage of. In terms of spread, temporarily it does protect you from infection, but we don't expect it to really have value in stopping spread. The value of this new vaccine is to prevent severe disease, hospitalization, and death, and we still have a couple hundred deaths every week in the United States from COVID-19. We still have hospitalizations from COVID-19, and those are all preventable if people take advantage of that vaccine, if people call their doctors immediately on testing positive and get Paxlovid prescriptions. So we have ways to even take the burden of COVID-19 even lower.
Yeah.
I love it. Well, I'm going to be, first of all, because of how you just answered the last question, I'll be looking for you on all of the Sunday morning talk shows because you just killed that. But is there anything else that you're keeping a close eye on medically that we need to sort of look for this season?
I think it's going to be important that we use all the tools, not just for COVID-19, but for influenza and RSV. Remember that we have RSV vaccines now for people above the age of 60. So last year we heard about that, that concept of triple-demic, where we had 3 different viruses hitting hospitals. Now we have tools to prevent that. So I'm going to be looking to see, how well not only is COVID-19 vaccine uptake among the high risk, but also RSV vaccines, flu vaccines. We're doing wastewater monitoring for all of these viruses. So it is a time that we're actually taking respiratory viruses seriously, which I think is a good thing, because they do exact a pretty big burden on the population and cause a lot of absenteeism and economic disruption. But now we've got tools to minimize that.
Sure.
Boom.
All right. Dr. Adalja, always good to see
Thank you, Dr.
A wealth of knowledge. We love when you come on and break it all down for us. Thanks so much.
When your book coming out, because I'm going to buy it.